hospital-based specialties, most of the billing companies that focus on one of the four primary hospital-based specialties work coast to coast. If it's an office practice, it's more common to find the billing company within 150 to 200 miles of where the practice is located. And most of the time, unless it's a very exotic specialty, there are sources available within a circle of that description. You want to get references, of course. You want to ask about and pay attention to the software. It may or may not be a familiar brand name to the practice, but remember that a lot of billing companies can afford to buy software that a practice couldn't possibly afford on its own, because the billing company is buying, in effect, an industrial package, and the practice, to analogize it, is buying a home use package. So there are differences. Of course, I think any billing company on the list should be a member of HBMA. HBMA.org is our trade association. It's a not-for-profit organization. It's member-operated, and it has really matured in the 18-plus years that it's been in business to be a real resource to its members. We have a code of ethics that members have to subscribe to, and if they're a member and they've been a member for a certain number of years, that's not a guarantee of quality, but it's an indicator that this is an organization that is committed to the industry that they're part of. And then I think one more point would be whether the billing company is active in the medical specialty activities of the practice that is thinking about outsourcing. Most medical specialty associations or colleges will have their own medical reimbursement or business-type conferences besides their clinical meetings. And if the company is familiar with those, has exhibited at conferences, for example, or is familiar with the leadership of that and knows about any coding issues for the specialty, that's a pretty good indication that this is a professional company that is interested in serving the practice.
Right. Bob, we're going to take a break here from our friends over at the Chester Company, but when we get back, we're going to talk about two final areas. One is pricing amongst physician billing companies, and the whole concept of, do physician billing companies on average outperform in-house billing? I'm Ron Nyman. I'm your host here at the Healthcare Business Network, and we'll be back in a moment.
Revitalize the image of your practice with marketing and communication services from the Chester Company. We specialize in helping you communicate effectively with your patients, whether it's a patient handout that announces a new service or a new website where your patients can conveniently make their own appointments. The Chester Company is here to help you present your practice and its services in the best light possible. Let us show you how. Call for a free, no-obligation consultation. 860-526-9903. 860-526-9903. Call now.
And we're back. I'm Ron Nyman here, your host at the Healthcare Business Network. We're at www.hbnradioshow.com. That's hbnradioshow.com. We're talking about physician billing companies this week with our guest expert, Bob Burleigh, and we were talking about the items, the things that you need to look for when you're going to be choosing a physician billing company. But we wanted to get to the issue, Bob, to discuss price. How do physician billing companies price their services? Now, I know it's not completely uniform, but what do you see predominantly through the industry?
Well, significantly more than 95% of all billing companies across the country charge a percentage of the amount collected. So theoretically, if a claim is submitted and the claim is denied and ultimately no payment is recovered from the insurance company or the practice, the billing company gets paid zero. So by a long distance, the percentage of collections method is the preferred method, not just by companies, but by their customers, because they have aligned interests. No collection, no fee provides an incentive for the billing company, and so that's worked out pretty well. There are some companies that charge a per claim fee. Frankly, you can reverse calculate either method into a percentage or a percentage into a per claim, and that's actually a useful exercise for practices, no matter which way they arrange it with billing companies. I should add one thing. The Office of the Inspector General, the OIG for the Department of Health and Human Services, which is sort of the big bad wolf, the enforcement arm of Medicare, has expressed some dislike for percentage of collection fees, but in fact, CMS has said over and over that they don't have any problem and they're perfectly legal to charge percentage fees. There are a few requirements that have to be met on how the payments are handled, but in general, percentage fees are perfectly legal, and that is the preferred method.
So if you have a hospital or a physician's office, they're conducting a request for proposal amongst several different physician billing companies, and they get back the responses. The big question you always hear hospitals and providers say, how can there be such significant price differences among several different physician billing companies? And what have you seen are the main reasons why that would happen?
Well, it's very much like going to a restaurant. I know your offices aren't far from New York City, and if you go to major urban, especially some of the high-end restaurants, they have the so-called pre-fee fixed price menu where you pay $100 for the entire menu. So you get a soup, an appetizer, et cetera, and billing companies may charge a percentage of collections, and that fee, that percentage fee, especially if it's on the higher end of the range for that specialty, that 1% may cover everything. In some cases, especially if there's intense competition, a billing company might, in effect, to use a healthcare billing analogy, they might unbundle their services. And so they'll say, well, if the market may be at 9%, I'm going to offer you something that sounds much lower, let's say 5.5%, and it sounds really good. When you read the rest of the proposal, it mentions that, well, there's $1 a chart for coding. We also charge for postage separately. We also charge $500 per provider for provider enrollment services. So when you do the math and add them all together, it's possible that the apparently lower fee is what actually going to cost the practice the same amount as the single fee or even more. So it's not a trick. It's simply the style of the company, and in some cases the company has responded to demands or preferences expressed by their own customers. And there's probably one other hybrid variation, and that is, in some cases, if the billing company is supplying the software that goes into the practice that's used for appointment scheduling, for signing patients in, for providing receipts for deductible and copay payments, for entering charges and diagnosis codes and patient recall notices and EMR and so on, some companies will charge one price for the billing services, whether that's pre-fee or a la carte, and a separate fee for the technology.
When you sit back and you're looking at a physician billing company's price, sometimes you'll hear physicians or even hospitals say, wow, this is an incredible price. It's like 3-4%. It's an incredible price. When is a good price too good? Or really, I should restate that. When is a good price maybe bad? Maybe when is a price that sounds too good really not too good?